Let me begin by just asking you to state your name.
Noah Kauf. I'm Director of Ovarian Cancer Screening and Prevention at Memorial Sloan Kettering Cancer Center.
Awesome. I just want to say that I heard Dr. Kauf yesterday. He gave a fantastic talk, and I'm going to ask him to discuss the reason why women should be looking at genetic causes of cancer in terms of understanding it for themselves. Why should women do that?
Well, importantly, of the 5 most common cancers in women, which would include breast, colon, ovarian, uterine, and lung cancer, 4 out of the 5, a major fraction is caused by inherited predispositions. Anywhere from 5 to 10% of breast, uterine, ovarian, and colon cancer is actually caused by an inherited predisposition that you can get from either your mother or your father.
So you can just grow up with the potential of these diseases and you might not know it. What would be a clue that you actually are a candidate to look for a genetic cause of your disease?
Most important thing to look for is certain characteristics within your family history, and importantly, these characteristics can be on either side of your family. But things that we're particularly interested in are if you've had breast cancer prior to age 50, if you've had ovarian cancer at any in your family, if there's someone who's had breast cancer prior to age 50, if there's someone who's had ovarian cancer at any age, if someone has had colon cancer prior to age 50, or uterine cancer prior to age 50. Any of those things in a close relative, and close relatives would be parents, siblings, children, grandparents, aunts, uncles, nieces, nephews, even first cousins. If that exists in the family, it may be worth exploring.
So let me ask you this. If you are a person who needs to get a genetic test, what are the kinds of tests that you might seek? What does it mean to get genetic testing?
Well, what genetic testing is, and actually probably it's better to think of it as genetic counseling, because genetic testing is a component of counseling. Genetic counseling is a detailed assessment of your personal history, your family history. It could include both whether or not you personally have a diagnosis of cancer, what cancers have occurred in relatives, if there have been if there are relatives who didn't live to be old enough to get cancer, if there are not enough relatives in a family to show a predisposition. And what can happen is a genetic counselor, medical geneticist, or other person trained in cancer genetics will first carefully look at your personal and family history and see whether or not it's suspicious for the possibility of one of these inherited predispositions. And if it is, there may be genetic testing. Frequently that is testing which can be done on a blood sample, although sometimes we actually will try and get tumor tissue from someone who's had cancer, and we can actually do specific tests on that to help identify if there is in fact an inherited predisposition.
Now yesterday I heard you talking about the fact that sometimes a person has no family history but still could have an inherited disease because people could have died too soon. Maybe you could just elaborate what a person might notice in their family history.
Well, even if in that setting it's when you personally have a cancer diagnosis but there is no other family history of cancer. For example, of women with ovarian cancer, and the most common type of ovarian cancer in the United States is something called serous ovarian cancer. It accounts for about 70% of ovarian cancers, but about 90% of ovarian cancer deaths. Individuals who have serous ovarian cancer, approximately 1 in 6 women will actually have that cancer as a result of an inherited predisposition. And even in individuals who have serous ovarian cancer and have no family history of either early onset breast or ovarian cancer, 1 in 10 will be the result of an inherited predisposition. Such that in 2013, if you yourself have been diagnosed with serous ovarian cancer, or a close relative has been diagnosed with serous ovarian cancer, even if there's no other family history of breast or ovarian cancer, it likely makes a great deal of sense to have genetic counseling to see whether or not genetic testing would be helpful.
So if you're a person who thinks you could be at risk for genetic diseases, in other words, diseases you've inherited, how do you go about finding someone to help you?
Well, the first place to start is actually to speak with frequently your gynecologist. The American College of Obstetrics and Gynecology has actually done a large amount of educational outreach towards its membership. There was a practice bulletin published in 2009 specifically dealing with the issue of hereditary breast ovarian cancer and giving specific criteria of individuals who should be considered for genetic risk assessment. If, in addition to that, there is on the National Cancer Institute website, there is actually a web directory of cancer genetic providers in the United States. And you can go and actually put in your state or your zip code and actually identify genetic cancer professionals who are near you, and you frequently can contact them directly.
So if your doctor is not familiar with genetic risk or not able to help you directly, is there a specific type of person that they should refer you to?
Frequently, it's going to be a genetic counselor. It can also be a medical geneticist. From the genetic counselors, what genetic counselors are is they are master's trained health professionals who have done 2 years of post-college training specifically in assessing family risk and familial risk of a number of different inherited cancer syndromes. They are facile in discussing whether or not there is a potential inherited risk within the family. If there is, what testing can do to help clarify that risk. And importantly, this is not just to identify risk. If we were just identifying risk but could not do anything about it, this would all actually be a very academic discussion. What we have, however, for most of the major inherited cancer syndromes is we have proven interventions to reduce the risk of cancers in individuals at risk.
What kind of things would you do to intervene, for instance?
Well, for example, women with an inherited predisposition to breast cancer caused by mutation in BRCA, the genes BRCA1 or BRCA2, which are the two most common causes of inherited breast cancer, have a markedly increased risk of breast cancer throughout their life, but also particularly at early ages. In the general population, about 1 in 50 women will develop breast cancer by the time they are 50. If you have a mutation in BRCA1 or BRCA2, as many as 1 in 4 to 1 in 3 women will develop breast cancer by the time they are in their 50s. The breast cancers can start as early as the mid-20s. And for this group of women, rather than just starting mammography at age 40, which is what is recommended for the general population, we actually start with a combination of both annual mammogram and annual breast MRI starting no later than age 30. Additionally, there are medications to reduce the risk of cancer, and we can also talk about surgical risk reduction strategies. It turns out prophylactic mastectomy is an option, and although that may seem like a drastic option, for an individual who has lost 3, 4, 5 individuals in their family to breast cancer, if we can show that they are in fact at risk, it is something which is an option that's actually taken by about 1 in 3 women with these inherited predispositions.
So if you have a risk for instance, breast cancer, it's not something that you have to do, it's something that you may be offered and you can choose to do it or not do it.
Absolutely, because we have 2 very good approaches for reducing breast cancer risk in the setting of an inherited predisposition. The combination of intensive screening with mammography and breast MRI has been shown to be better at detecting inherited breast cancer than mammography alone, and it has also been shown to identify the cancers earlier than would be the case with mammography alone. And there has been modeling that has been done that really suggests that it will be associated with a substantial improvement in life expectancy just participating in screening.
So the bottom line is if you have a family history of people in your family dying of cancer before age 50, that's a very important clue. And you should see a genetic counselor.
And the one thing is, it's not even dying before age 50, it's being diagnosed before age 50. And that would be for breast cancer, colon cancer, or uterine cancer. Importantly, ovarian cancer, doesn't have to be early onset. And anyone who has a family member who has either been diagnosed with or died of ovarian cancer at any age, it's worthwhile to speak to your doctor about the possibility of genetic risk assessment.